Hello to everybody. I'm very proud to introduce you the first reliability study about fascial manipulation. As we know the importance of the assessment in manual therapy, we decided to test the reliability of motor evaluation and palpatory evaluation in a fascial manipulation technique. The assessment of the subject in fascial manipulation is realized both with the motor functional test and with the palpation of some peculiar point named center of coordination. The motor evaluation is conducted in each impaired segment of the subject and gives you information about the most painful myofascial units of each segment. The palpatory evaluation investigates the gliding of the deep fascial tissues in specific points named center of coordination. Shows that the elevation of the gliding of the deep tissue in these points are related to the functional impairment and the pain of the subject. So we decided to design a reliability study for an inter-operator and an intra-operator reliability assessment. All the people after the first assessment has been divided in two subgroups. One of the two groups has been submitted on a 3-weekly session of fascial manipulation treatment. Both physiotherapists realized the first reliability assessment at the entry in the study, but only one, the physiotherapist A, realized all the treatment in the study group, and only the physiotherapist B realized the final assessment, the intra-operator assessment, at the end of the study 1 month after the first assessment. We recruited people with primary coxarthrosis with no conservative treatment indication, but only surgical indication by the orthopedic. Dividing all the population in two subgroups, we have not only the possibility to test reliability assessment of fascial manipulation, but also the efficacy of the treatment in this population of patients. The treatment in fascial manipulation consists of the simple but very specific deep friction in the center of coordination that are palpated as more stick and stiff. Warming the connective tissues, the physiotherapist is able to perceive under his elbow and finger a better gliding within the center of coordination areas. Analyzing the results of the ICC analysis and the Cohen agreement percentage, we were very surprised because the results were very higher than our expectation. As you can see in this table, all the ICC results, both for inter and intra-operator analysis, got to very good to excellent results. And this is very interesting because all the operators involved in this study at the time of the study were students of the third year course of physiotherapy degree course. Our attention went also in the intra-reliability results and in the difference that we had between the study group and control group, with the lower results in the study group. Our hypothesis is that fascial manipulation treatment has been able to really modify the gliding of the tissue in the study group and then improve their movement and the pain. In fact, in this table, you can see how the study group gets better results both statistically and clinically with respect to the control group in the outcome of the pain, in the movement, and the palpation of the tissues. Then, at the end of the study, we can conclude that the fascial manipulation assessment procedure are really reliable and that the fascial manipulation treatment is really effective with the people with primary coxarthrosis with no indication of conservative treatment. Thank you for your attention and have a good read of this paper.